They're fraught with a variety of issues, not just medical issues, but socioeconomic issues, food, shelter, clothing. And so community health centers, the aspects that differentiate us is that we have many support services that are connected with the direct medical care that consist of assistance with medical funding, food, shelter, other types of support, transportation, and there is a lot involved in nutritional counseling, health education, in addition to the physician visit, dental visit, and in the case of behavioral health, it's an important aspect of our care too. With respect to the challenges and the demand, as you add all that up, in a shortage area to begin with, we cannot keep pace with the entire demand for care. And whether you're an insured individual or uninsured individual, those individuals are coming to us for care. And so we're preparing ourselves through expansion activities in all of our areas to address that. But
Paul, if we can follow up on that, because given the economic realities of today, statewide as well as on the Big Island, more and more families are struggling just to make ends meet. More and more families are experiencing the loss of a job, maybe from the key breadwinner, and perhaps some for the first time from having healthcare insurance to not having anything. And because of the economic realities, the uninsured numbers appear to be on the upswing.
yeah.
Can you maybe share with us, and maybe for the Big Island community, for families that find themselves in that particular situation, what can they do? What can they perhaps look to you folks for in terms of support or services and care?
We, community health centers by nature provide primary care. So we're basically a doctor's office that provides the other things that Paul talked about, which are enabling services. If you don't have a ride and you can't get to the doctor's office, we'll provide transportation for you. We integrate our behavioral health into our primary care. And so anyone that finds themselves in a situation where they don't have insurance can come to the community health center, and we will look at their income, their family size, what their needs are, and try to match them with programs and services that we have available. We've got special grant programs that help people obtain medications if they need them. We even have programs that will help someone maintain their electricity if they're going to have their electric bill or electric turned off.
I even remember programs where women could get mammograms or or help with cervical cancer, right?
Exactly.
So why don't you tell us about a program like that?
The BCCCP program, which is a breast and cervical cancer control program, provides screening for cervical cancer, pap smears, and mammograms for women who are over the age of 40. We can help them get in and have the basic screening tests done, and then if they need follow-up care, there are funds available to pay for that.
One of the critical things too about community health centers is that we have a sliding fee. So for those who have no insurance, and based on their income, we will adjust their visit, the cost of their visit, to certain percentages. So for instance, if someone's at 100% of the Hawaii federal poverty guidelines for Hawaii, and I don't remember what those numbers are, we will each slide it to a minimum copay. And I know for West Hawaii it's $15, for Bay and Hamakua it's about the same. So that's all they will have to pay when they come for a physician visit. Now they may have to pay for their x-ray or their lab work, though we even have lab services, limited lab services. So we can provide a lot of the services at a lower cost if they have no income or find themselves newly uninsured.
And the nice thing is that we're still taking new patients. A lot of the people who had insurance or suddenly find themselves in a situation where they don't, or those that actually have HMSA and have good jobs, if they can't find a doctor that's accepting new patients, they've been coming to the Hamakua Health Center. So
now, and that also puts an increased demand on our ability and capacity to serve. Other things that are happening in the economic environment in terms of some of the shortfalls in the mental health environment, we're finding that there's a growing demand coming to the health center. So we're responding in terms of enhanced staffing of behavioral health professionals within our environments.
That brings me to like a label that we often hear. I'd like your thoughts, all of us. We hear people say the healthcare safety net a lot. And here at the legislature, my Senate colleagues and I, we often have real spirited debate, about what is the healthcare safety net? What does that mean exactly? One thing that always has occurred to me is it's at least that last line of defense against someone getting no health care, which, if I'm not mistaken, you guys never turn anyone away. And
No.
people should really, I think they should come away from our half hour today knowing that if you can't find a doctor, go to the health centers. Find a way to find your local health center. On Big Island, they are geographically placed terrifically, so that anywhere on the Big Island, you're going to find a health center pretty close to you, and you won't get turned away. Even if you don't have the $15 on you, I know that they work things out, and so you're going to get some care. But what does that healthcare safety net mean to each of you?
I'd like to maybe first to respond to that. I think while we serve as a safety net for primary care, meaning the medical, the dental, the behavioral health and enabling services, I think it's important to point out that we can't do it alone. And it's very important, and we're looking at ways and means that we can link with community stakeholders, particularly in health-oriented agencies, Native Hawaiian health systems, HHSC hospitals, to work together to address the needs of these patients. We can do a lot to help the individual who's uninsured, but should they need specialty care, should they need hospital care, then we need the help of others. And also other types of practical services, be it transportation or having someone help navigate the health system for that patient. It's a very important feature that we all need to work together to support on behalf of the community.
Susan, I know that you, for instance, live in both worlds. You are on the board of, I think, the board of directors at the hospital.
For East Hawaii Regional.
For East Hawaii, and you run a health center. How's that, those two hats, how's that worked for you?
Actually, in the Honoka'a community, it's been wonderful. And we have a second clinic up in Kohala, too. And so our clinics are positioned physically adjacent to Kohala Hospital and Haleho'ola Hamakua.
Yes.
And so we've been able to work out some wonderful partnerships, especially with Haleho'ola, where our physicians cover the emergency room. We're on call for all the residents that are in the long-term care facility. And I am the voice for that community on the East Hawaii Regional Board, so that we don't forget about the fact that HHSC is comprised of acute care hospitals, but also critical access facilities that are in very isolated areas around the Big Island and on other islands throughout the state. So it's been a really nice synergy.
And I think that we're seeing that there's so much need